President Trump has repeatedly tried to say that the flu kills tens of thousands of people. He said, who knew the flu killed? It actually turns out that his grandfather, Friedrich Trump, died of the flu in this country at a young age. But he tried to use it to show, coronavirus doesn't even compare. So talk about both, the language we use and what it means in comparison with the flu.
Well, COVID-19 is the name of the disease, not the virus specifically. And what we're most concerned about is obviously the spread of the disease. Let me talk about the flu. And the flu is a big killer, and it does infect many people. I think we have roughly in the range of 15 to 20 million in this season alone in the United States, with a roughly 1 in 1,000 death rate. So in the range of 15 to 20,000 deaths from the flu. So the flu is very, very serious. But that represents roughly 5 to 7% of the U.S. population. And the reason it doesn't represent more is because both we have flu shots and we have years, decades of sort of cross-reactive immunity built up over people who've been exposed to different virus strains. The difference in with this virus is two. First of all, no one is immune. So in theory, 100% of the population is susceptible to this virus or very close to it. The second part is the fatality rate, either for people who present to the medical care system sick enough to go to a doctor, or per infection, which is something different because not everybody who is infected necessarily goes to a doctor, looks to be a fair bit higher than the flu. Maybe on the order of 5 times, maybe even 10 times higher than the flu. So we have a much, much larger reservoir of susceptible people on the order of 10 to 20 times larger. And we have a fatality rate that is between 5 and 10 times larger. So that's why the potential for this, even though we have a tiny fraction of the cases and deaths right now, why we're taking the extreme measures that we are taking. Now, all that said, the fatality rate can be affected by what we do. And that's why we're doing it now, because the fatality rate is a function both of the age of the people who are infected, but also of the capability of the medical care system to take care of them. So if we can protect the medical care system, that is, keep the number of patients coming in at a rate that they can be cared for with adequate ICU beds and ventilators, et cetera, and also healthy medical care folks, we can keep the fatality rate low, or at least lower than it would have been without that.